I hope you already had a bite or two, so that you are energized for our session. My name is Christine Sperrenbach from Future Health Lab. I'm happy to be here and host this session with my panelists. It's on health in our hands, prevention as a community effort. And you're really lucky to be here because you will be listening, and not only listening, hopefully also asking questions. It's a really interesting topic which concerns all of us. And the ones who already participated in the panel session earlier today, they know that prevention seems to be a big topic, also when it comes to new technologies, AI, and so on and so forth. So maybe we'll also touch upon this kind of topic in our discussion today. So, let me show you again our panelists. I'll be introducing them now as we go. They will share an initial statement, then I have a round of questions, and then you audience are invited to also place your questions, comments, maybe experiences, so that this is a lively discussion and not just us talking and you may be listening or drifting away with your cell phones. We'd really like to have you on board and make this a shared conversation. All right. Now I'm confused with my notes. All right. Even though the cost for public health care is rising, or at an every time high, we focus most of our energy on treatment and cure rather than prevention. So what is it that makes us really invest more in prevention or the promotion of healthcare? And what can communities, companies, all of us basically do to make this a shared effort to make us all healthier and live longer in good health? Welcome with me to today's panel. I'd like to start with Petra Plunger. Petra is a pharmacist and public health expert by training, who has worked as a researcher and lecturer in renowned institutions. Besides her work at the Competence Center for Future Health Promotion at Gesundheit Österreich GmbH, Petra is one of the facilitators of the competence group participation of the Austrian Society for Public Health. Welcome, Petra. Please grab one of the microphones and already share your first initial statement, the one you'd like to start this conversation with.
Do you have to switch?
Test.
Brilliant.
Well, I managed the first hurdle. I'm very pleased to be here. Many thanks for having me here for this panel. As you've already mentioned, I'm working at the Competence Center for Health Promotion, and we had a quick chat at in the break. If as the session is labeled prevention, we had a quick chat if there's a real difference between health promotion and prevention. If this is just kind of an academic distinction, and I would now start saying yes, there is a difference. And I would like to remind, there are a lot of people who might not have lived at that time, but there was the Ottawa Charter in '86 saying that health promotion is first and foremost a process of enabling and empowering people to increase control over and to improve their health. So it's really an approach which is very much about empowerment, and this is actually the area I'm working in. And my first statement would be, I'm working in healthy aging for most of the time, and looking at this area of work, I would say that enabling and empowering means for us as experts not only developing evidence-based interventions, but also at the same time advocating for healthy aging at different areas of society.
Thank you so much. Please pass on the mic to Karin. Karin Hofer is leading the field of prevention and healthcare promotion at the Österreichische Gesundheitskasse, ÖGK, the largest social insurance company of Austria. And this is quite something, because more than 80%, precisely 82% of the Austrians are insured with ÖGK. That means 7.6 million people. Yeah. That's quite a number. So I guess there is quite a lot that can be done, and you'll be share hopefully some of that later on. But Karin, please share your first statement with us.
Thank you for the invitation. Well, I was asked for a short statement for the beginning, and it was not so... Well, I was thinking about what really to say in only a few sentences. When I want to put it short, well, if we really want to improve well-being and health of society and of individuals in Austria, I think we have to focus on two levels. We have, of course, to focus on the level of personal habits, personal health habits, but we have as well to focus on a health and all policy strategy. Health is not only produced in my private surrounding, it's not only my private health habits, if I go jogging every day and if I have a healthy nutrition. It is also shaped by my working conditions, by public traffic systems in the city where I live, and many more factors. So what we do as ÖGK, as health insurance, is to focus on both levels. We offer programs to support affected people, prevention programs to change their lifestyle habits, but on the other level we focus on settings. That means to look at companies, to look at school system, at schools, what can we change there to improve the conditions the people are living there. And I think it needs both approaches.
Thank you so much. Igor. Igor Grabovac graduated in medicine from the School of Medicine, University of Zagreb. Soon he developed an interest in improving health in vulnerable communities. In his work, Igor focused among others on LGBTIQA+ people. He holds a doctorate in public health and is associate professor and specialist for public health at the Medical University of Vienna. The Grabovac Group is interested in how implementation science and social medicine can create healthier communities. Igor. Quite a lot.
I mean, the only guy on the panel gets an applause. Doesn't seem right. Also, as the only man, I am the only one who did not come with a prepared statement, so this is going to be off the cuff. I am not insured by GÖG, so I allow myself to be critical. No, I wanted to say I voiced a lot of the things that you already mentioned. One of the things that I would like to be a key takeaway for us today is to remove ourselves from the conversations about inequalities and equality. I think it's far time that we, especially in Austria, but in Europe, move more towards the concepts of equity, and especially not only social justice, but health justice. We need to consider that as an overarching topic of our conversations today, participation and working together, that this does not mean one-to-one. It does not mean that we all share the same amount of burden. I think we need to be aware that people who come from more vulnerable backgrounds have more needs, and that when we create systems that are supposed to be improving the health of our population, our communities, they need to really take into that account. And that's it for now. Thank you.
Thank you so much. Last but not least, Sandra Thier. Sandra spent most of her professional life in newsrooms and communications. She used to be a TV journalist and news anchor in Austria and Germany, precisely at ATV and RTL 2. And she co-founded and is co-founder and managing partner of a production company, and now newly co-founded the Digital Health Club, which is a digital B2B platform that works like Netflix.
Thank you so much. Thank you for the invitation and that I have the chance to introduce you all the Digital Health Club, which is brand new. Of course, we worked on it for over a year now, and we launched it in the middle of March this year, so it's really quite new, our newest, latest baby. But our initial statement is now companies are facing a lot of challenges today. We know this, everybody knows it. But also one of the biggest challenges is how to keep the employees healthy, motivated and productive. And as Karin also said, with Karin also, every one of us should have the time in our work time to do sports or to do healthy things. If you work for military, for example, you have to do sports every day or do healthy things. So it's a good idea. And the B2B platform, the Digital Health Club, we start now as a B2B platform because we go to companies and say, hey, you are responsible, help the people to become more healthy or stay healthy. So it's a prevention thing also. And our thinking was not only doing workouts. Health is more than only doing workouts. Health can also be mental, or also can be female leadership, or also when I'm 50 plus, anti-aging or longevity is probably a topic. So health is more than just Pilates or yoga. And so we created the platform with over 14 topics where everyone from 20, 30, 40, 50, from office assistant to the top level, everybody should find something that fits to him or her, and you can use the platform and the app 24 hours, so you can use it at home, you can use it in the office. So that was our idea, and it's ad-free and just fun because it's a streaming platform, so it looks like Netflix or Amazon Prime, as you know, and even the younger generation knows how to handle platforms like this.
All right, thank you. We'll probably have even more details later on. It was already touched upon in most of your initial statements that especially prevention and the promotion of healthcare is dependent on a variety of factors, being then personal factors, social factors, and institutional factors. So we can tackle that field from quite a broad variety of angles. And that means whether we live healthy lives or we engage in healthcare prevention is dependent on our age, our gender, on our educational background, on our social network, but also on our workplace and whatever other facilities are out there that we can use. So that being said, it's a really broad topic, and we all should basically be working on that topic 24/7. Still, that's probably not possible. So let's learn from good examples or from cases that already work well and see what we can copy for our own environments. Petra, I'd like to ask you the question, since you mentioned you focus in your work a lot on healthy aging in communal settings. And we also heard that prevention should or mostly does not take place in the official healthcare system, but everywhere else. From your experience on your work, why do local authorities engage or set initiatives to promote healthcare or health, or why not? What is it that they might overlook? What kind of benefits are out there also for other contexts, so to speak, not just healthcare, so to speak?
Well, from my experience as a previous researcher and now in the competence center, we're working more on the meta level, so we are not directly working with communities, be it villages or cities, but I have done it before. I would say that local authorities I think aging is an issue, you can't deny that. So I think local authorities or regional or national authorities are pretty aware that we are in the midst of a demographic change and that we have to deal with it very, very simply. I think local authorities are very approachable when experts, when they have the chance to collaborate with health promotion experts on healthy aging. And I think this is something Austria can be pretty proud of, that we have networks of experts, expert organizations in health promotion, but also when it comes to healthy aging, experts in social welfare organizations who are also engaged in health promotion activities. So we have I think a very lively and vibrant scene, so to say, of health promotion and healthy aging activities in Austria. We also have networks like the healthy communities networks in several federal states in Austria, or the healthy cities networks. So a lot has been achieved also on the organizational levels in the last, I would say, like 50 years when it first, when the first initiatives at the local level started. But I think there's still a lot to do on the strategic level to really work on sustainable financing for these initiatives. We see a lot of project-based initiatives in Austria, but we really have, I think, to work towards sustainable financing of a lot of these initiatives, who are really making very good progress. And I think Igor was mentioning it, we really have to take again and again a very critical look at health equity. I think, being in health, I have been in health promotion for quite some time now, and I think we as experts should also be critical of what we want to achieve, how we achieve it, but also if we are creating some unintended side effects. Let me say that I'm a trained pharmacist, so this is something I'm quite aware of. So we should really critically look at what we are doing and what unintended effects we might have. I think another issue would be to more broadly make visible the impact health promotion has in different areas of society. This would then be really focusing on co-benefits that health promotion has, for example, for other areas. We have a project running now on health promotion and the impact of active mobility and healthy eating also on climate change, for example. So it really need to explore on a policy level what are the co-benefits, and we should really go deeper into that. And coming back to local authorities, I think we, as experts, we should also be very aware that we often use very technical language. So I think we should shift sides and really understand what is it, what local authorities really need. And I think if you could argue that health promotion measures are not only effective on the individual level, we have heard it already, but also on the community level in terms of fostering social networks. We could also say that this might have a positive impact on the image of a village or a city, so as a good place to live in. And I think we should really be very proactive. I was raised and I grew up in Carinthia, in an area which is really one of the areas facing demographic change. Like a lot of people are migrating to bigger cities and are not coming back, especially young, very well-trained women are not going back. So I think that we should be proactive on that and say this could be like a regional lab to really experiment with healthy aging approaches. So really proactive face this not so easy topic would be my take for that.
That sounds really interesting. I have a bunch of ideas already on that, but thank you for now. I hope we can touch upon that later on. Karin, that sounds like some also touch points for ÖGK, and I know there is a lot of offerings that ÖGK already provides for people in terms of prevention. Still, the focus lies on cure or treatment. What is according to your experience and your work, still already works well, and where is the room for improvement? Is it that you get more budget, or is it that you try to get different allies outside of ÖGK, so that, for instance, local authorities, and so on and so forth? So please share a bit from your work.
Well, I share your view that many programs are offered, and we have indeed succeeded. But the real problem in Austria is that prevention is still regarded as an individual approach, as a kind of, we are appealing to people to change their lifestyles. But this, to put it in this corner of individual responsibility is very a restricted position, because we need a system approach. It's not only the individual that is responsible for his or her behavior. Of course we are, that's not wrong, but it's not enough. And to make it clear what I mean, our children are sitting in schools, depending upon their age, between 4 and 8 hours a day, probably also 9 and 10 hours when they are young adults already, without any physical movement. and their sports lessons are between 2 and 3 hours a week. And when they are sitting or spending their day in the schools, they don't have nutrition, healthy nutrition. In many schools they don't have lunch or nothing at all, but even if they have, it's not a healthy nutrition which is offered. At the same time, fast food and sugar beverages are easily available, very cheap, and the result, which we can see every year, the rate of overweight and obese children is increasing. It's really incredibly increasing. In the meanwhile, it's between 25 and 30% of all Austrian children. I know it's even worse in the UK or in the US, but I mean, that's not really... yeah, we should not compare to that. Well, and of course I can say it's the families and they should do something. But on the one hand, families, what does it mean? Mothers who are also working, children who are at school the whole day, and even if when they are not at home, there is no one who has time to make sport or whatever with them. So I think we should ask why our schools cannot be healthy places to grow up. Because overweight children will be obese adults, and obese adults, aside from the question of well-being of people, are a really cost factor for the whole health system. Obese adults cost 7 times as much as normal adults a year for the health system, so we should focus this issue also from a cost view. But these changes which are needed cannot be made within the health system, and also not from health insurance or a Ministry of Health alone. We need other policies. We need educational policy. We also, I think, need traffic and planning policies, because children who can walk to school probably make have more physical activity than children who are brought to school by car, because it's too dangerous to walk. So we need a lot of other policy areas. I think that's the most important issue, because it's our children and our future. But the same is of course true for our situation. We spend our day normally at work. And it's not only the physical activity, I agree with your point, but it's even more. If we have good leadership, if we have good communication, if we have efficient processes in our work, we have less stress and burden, mental burden, and we all know that burnout and related illnesses also are increasing or have increased. And with good working conditions, we can find this development. But again, it's not a question of the health system. We need other policy areas or other policies where, for example, we could reward companies which invest in health programs. But for rewarding companies, we need probably Federal Ministry of Finance or other areas, but definitely not the health system. So I think we have to look for a system approach which aims at different policy levels, not only the health system, if we really want to improve the health status or the well-being of the Austrian population.
Well, so next time we also have representatives from all the ministries, hopefully here. You mentioned basically what kind of initiatives or activities could it be, and then for me the question is, who designs these offerings? And Igor, I know you have a very special or not conventional approach when it comes to research and trying to define what kind of offerings are actually needed. Could you please share a bit on that, and maybe what's your secret when it comes to conducting research and then coming up with solutions that hopefully work for the addressed group?
So we work with highly vulnerable populations, or people who are in very vulnerable context. You already mentioned the LGBTIQ community. However, most of our work now concerns people experiencing homelessness, people without active health insurance, who live in Austria, as well as people with very hard mental health problems, and trying to see one step above from what you were talking, what do we need in the system at all to have them access the services that are already there. So one step beyond. What we are trying to establish as sort of a new culture of doing research and doing also implementation within the Austrian public health system is focusing on participatory action research approaches, meaning working together directly with communities and trying to sort of reduce the normal top-down approach that is very prevalent within the biomedical way of thinking. Now, I can give you a very philosophical answer and say, well, we need to establish new epistemologies of how we create knowledge, and that, you know, we need to understand that people who live with certain contexts are experts in their own right. When we are talking about people who come from very vulnerable backgrounds, it is hard for us, any of us, regardless of how many academic knowledge we have, we don't really know what the living context is of a woman who is homeless, who lives in a tent at the Donauinsel. It's very difficult to say what this person needs in the system and how do we approach changes. So what we tend to do is starting from ground zero, working with the communities together, and then establishing trust. That is one of the key elements, especially when you're talking about highly vulnerable populations. People from highly vulnerable populations, which is true for a lot of communities, have distrust towards researchers, towards people coming from the government, towards people who, even if they're coming from a position of power, do want to implement change. They're not very welcoming to those people because they're used to being used. They're used to, you know, people collecting their data, going away, never seeing anything that sort of improves their situation. So I was also asked yesterday on how do we actually do it. So when we remove now the philosophical angle, how do you reach people? How do you reach that woman who lives in a tent in a Donauinsel? Well, first of all, you do a mapping. You try to find out who are the relevant stakeholders within the, let's say, city or geographical area where you're working with. You identify let's say, community representativeness or groups that are active in that area. We live in Austria. It's what do you call it? A Gesellschaft nation, right? So there's so many associations, civil society associations dealing with various topics. So that's not very difficult. And then trying with them to reach the people who are actually, let's say, the end users of the interventions that we are planning. Then we need to talk to them and try to see how we can actually work together to define first what is the problem, because what we think is the problem may not be the problem that the people actually need solving. Maybe it's something completely different. Then you define the problem, then you try to define solutions, you work together, and you try to bring as many stakeholders at the same table together. We had this very large European project that was dealing with participatory methods going into cancer prevention for people experiencing homelessness. And one of the first questions that we had was, well, do we do these meetings with people experiencing homelessness and the professionals together? And at the moment it was a serious question, because how do we navigate the power dynamics here? But then we decided to definitely do that, because we realized that people coming from the ministries and from the clinics and from the insurances and so on never spoke to a person who is experiencing homelessness, right? They most of the times don't have any experience of these issues. They try to look away when you see them on the street. These are all natural, normal reactions. So we sort of forced that idea, and then we tried to see what we can develop together. It's not easy, it takes a lot of time, it takes an enormous amount of money on top of what you would normally get for any sort of research project, but in the end you get data that is rich in context, in the living context, and you know, whatever the Complexity Hub does, and I see Amina there, right? That's with the beautiful data sets, you need that level of contextualization from the communities to explain that data, because you get the richness that you would not normally need. And then you go to the policymakers and you have all of this additional data that shows their, you know, why this is very relevant.
Thank you so much. Sandra, you already chose your target audience, so to speak, people at work, and you designed an offering which is apparently very low barrier. It has expert content, it is available 24/7, it is online, so on demand. I know that the Digital Health Club just started, but still I guess you already have information on do people use it, when do they use it, and what is it that, from your experience, makes people in their work context, or maybe before or afterwards, really get off the couch and do something,
The motivation.
themselves. Exactly.
Yeah. So my experience, we are working with large companies, but also small companies. Every company is different, but it's diverse. We have, when the company is very large, you have, for example, a lot of people with different cultural backgrounds. So you have to address them differently, for example. So we learn a lot because we want to give the videos also in different languages, so that you can also say the company, okay, you have very much Hungarian people working for you, okay, we can dub it in Hungarian language. That's with KI possible, which is great, because then you have content made in Austria from experts, from doctors, coaching, personal trainers, in all these fields we offer, and you can choose then in the language you want to listen to it. How we motivate, everybody from us knows that we have intrinsic motivation like enjoyment, mastery, identity. We have extrinsic motivation like appearance, social pressure, health concerns, and we also have, of course, psychological factors. What we learn now is that we go into companies, we are talking with the CEOs and the HR manager. And we ask, who is your company? Who is working there? What are your concerns? What do you need? And then we develop also content strings together, and we also say we can tell you which field is watched most, and then you can also have this expert in your company, so we can have activation days or action days if there is a doctor very well watched in this company, or for example, in this platform you can also search for neck, shoulder, burnout, stress, as you said, and then when I know this is a company boss, okay, lots of 80% of watching stress management and burnout videos, then I'm alert and I can do something in progress and support my people and do something different, that the stress level goes down, for example. So that's why it's very important to work with also the CEOs and HR managers. And what we learned in smaller companies right now, because we have the one-on-one presentations also for 50 people or 100 people, they come and say, okay, can you also take this, can you also produce this topic for us, because we want to know it, so they can communicate with us, which is really motivating also. For example, if there is a social media trend like chair yoga, okay, yeah, we can produce chair yoga, or there is the Wandpilates, the wall Pilates, but I don't want to have the app on my mobile. We can produce also wall Pilates for you, or so we can have all the suggestions also from the companies, which is motivating. And what we learned now, that some people ask, boss, can we do this in the conference room during the lunch break? Yes, of course. So every company works a little bit different, of course. So we learn a lot, and the people are very happy when we come and when we are talking together about health in general and what the people need and what the people want.
So the magic lies in co-creation. Thank you so much. Taking a look at my watch, I'd like to open to the audience now for a first round of questions. I mean, we have probably a lot of touch points that we can deepen, but I'd like to have you active as well. So is there a question from you, dear audience, already at this moment in time? Okay, if not now, then maybe later. Then I'll take one of my questions. And I'd like to address you again, Igor, because you work with very specific target groups, and we often hear about digital tools that might be a helpful thing, or that promises us this and that, and I wonder whether this is true or it's just an excuse for not really looking what is needed. What is your experience, or at least your take on that?
I mean, now already for decades we know that new technological developments within the field of medicine, especially regardless if we're talking about apps or new CT machines, or if we're talking about developments of new medicine, tend not to improve health equity but rather make the gaps even larger. Because people who don't have access to basic services are now going to have an extra service that they're not going to have access for. So that's also why I'm a little bit more critical when I go to Brussels especially, and we hear all about these wonderful projects now pushing artificial intelligence everywhere. I always say, okay, technical innovations are definitely needed. Also in our projects, we developed our own software, we developed our own digital solutions to be able to track the progress and everything that we were doing with people experiencing homelessness. However, technological solutions without the social level, technological innovation without social innovation that follows it will not lead to, in my opinion, any improvements in terms of social justice or health equity. So if we're talking about that, it's of course needed, it's of course necessary, of course it's also a question of what target group you're having. But to think that what unfortunately is often placed in media, new technological solutions are going to be an end to all of our problems. They're not. They're more likely to cause new problems because unfortunately we're not seeing all of these new things through a critical lens. So always ask yourself, okay, to whom am I doing this? Who will actually have access? And try to think about how you can maybe make it broader.
Thank you. Again, invitation to the audience. Yes. Danke.
I wanted to ask, what are your experiences in helping people understand that health is something really beneficial to them? Because sometimes it feels to me that actually the problem is that we only notice health when we're sick. And so what can help with this? Because I think if the topic is community means people and people being together and all of that. What helps with this shift? Thank you.
Well, I can start. I think I will follow up on what Igor previously said. I think this would be like the shift in the mindset I was mentioning at the beginning, like health promotion is about enabling and empowering. I think the first step we as health experts, researchers and so on have to take is to understand what is really important in people's lives. And very often it could be, or sometimes it could be, priorities are different between what you think is important for this person in terms of health and leading a healthy life, compared to what this person is actually facing in daily life, and this might, lead to a different set of priorities. So I really would strongly encourage to really work in health promotion. It's like work bottom up and participatory to really try to understand what people are facing in daily lives, what their needs actually are, and then work with people, on these needs and try to further develop approaching or whatever. And I think this has really extend to. I would be very thrilled to see if this could extend also to policy making, if we could really embark on participatory policy making, because I think it's very, very logical to be here at this kind of top-down approach, also in health promotion, like saying, okay, we have to reach out to other fields of society, we have to collaborate with various social and political fields, we have to look at co-benefits, but still I think if you're losing people on the ground, and this is, it's not in hierarchy, if you're losing people on the ground, I think then you're missing something. So whether you start with a very small project where you try to somehow promote health of different groups of people, or whether you start at the policy level, I think it's always with people. It's actually nothing about us without us would be the same. Hopefully underscoring that.
Yeah, Karin.
Well, I think we have to invest in health literacy. We have a real problem in Austria that health literacy is generally very poor. And of course, in vulnerable groups, it's even poorer. And for this approach, I think we also need, again, the settings, because it's very difficult to reach persons who are not really interested in health, as you pointed it out. and who have living conditions which are not in favor of caring about health because they have a lot of other things which have higher priorities in their daily life. And that's why I think it's so important to use the educational system, but also to our work system, where we work every day, the companies, because there we reach the normal people. I will call it that way, the normal people, and also vulnerable groups, because vulnerable groups are not only homeless. We know that migrants have a poor health status compared to, how do you say that in English correctly, original Austrians, or yeah, you know what I mean? And we have to do something, because migrants are now up to, or persons with, migrants are up to 30% of our population. And it's, for me, really a big problem when we can absolutely not reach them and their health status is poor. Their children often are overweight or obese. The teeth of the children are in a poor status and we don't do anything. I think that's really something we have to face.
But language is a big factor on
it's not only language.
Not only language, because most of the time they don't understand German.
I don't think that's only a question of language. Then it could be easily solved because we could translate. But it's not only language. I think we have to look for new ways to reach the people, and there we need, of course, science. But I also agree it's difficult from outside. I think we have to work with the communities and to develop strategies together with them, because it's their health and their life, not ours. And if we come and say you should do that and we help you, I mean, no one of us would like to be treated like that. So we have to develop new ways.
And it's really a big gap, Karin, what you say. If you see in my world, you know, the social media world, we are working with influencers a lot of time. They are all healthy, they don't drink alcohol, they are slim like this, they are sporty, they do every day. No, it's a really gap. What do you think?
But it's awful. I mean, I think they're awful.
I know a lot of young people, and I think it's good if they don't drink and live healthy. But yeah, I can see your point as well.
Igor, you were biting your lips. I can totally see that.
Just-
So what's your take?
Just because it was a key word here was priorities, and I do agree with you. First of all, I mean, this is something that we experience with our projects constantly. Why are you working in terms of health? And our project was the first ever project from the European Commission that they financed for the topic of health and people experiencing homelessness. Why would you care about this? They need to find a place to stay. They need food. They need basic things. And you then go to the professionals and you talk to them, so professionals, social workers, and people working in the front line, and you get the same answers. Why health? Why prevention? This is not that important. I mean, you know, they need to find a place to live, they need to find this, they need to find that. But then you go and talk to homeless people, and this is back to you, it is. I think we all have an inherent understanding of our health. Maybe we're not proactively thinking about it. But when you ask people about it, then you get answers that go beyond what you would expect in terms of, I'm just waiting to be sick. So there is an inherent understanding. What we found out, our people experiencing homelessness in our research were all very concerned about their health. They understood that they're constantly on the move, they understood that they are living in harsh conditions, that they are exposed to the elements, that they don't have access. When we asked them to prioritize or to think about the priorities, yes, of course, finding shelter, finding food, and so on was prioritized higher than let's say going to cancer screening or taking a vaccine. However, I need everyone here to understand, and most of us here are working within the field of public health, this all is health. There is no differences in priorities, because shelter and food and literacy and having a job and having access, all of that is health. It's not different. All of that is health, and we should consider health in a broader setting. We as professionals also, right? So there is this prioritization is artificial. It's in our heads. But all of the things that are influencing your daily lives influence your health. So they're basically the same thing. Sorry.
One more question. Looking at the time, we have 5 minutes left. So yes, please. And we'll be quick in
I have
answering.
a question when it comes to financing the healthcare system, because I see a lot of challenges there, because, for example, GPs get paid by diagnosis, or hospitals get paid when they do a lot of operations. And I don't see, do you see or a chance that the financial part is going to change so that we can measure?
So that there is more of a reward in terms of if you
Yes.
make your patients live healthier lives rather than treat them. I guess that's a question to social insurance.
Sorry, but I don't think that health and well-being is a question of the medical system. I think we should think health in another system, as Igor pointed it out. So I don't think, I agree that our system, our healthcare system should be financed in a different way, that I agree. But I think what you wanted to say is it should be changed into paying for health instead of medical treatment. No, because I think health is not produced by a general practitioner or by a hospital. It's produced outside the healthcare system. We have also to do changes in our healthcare system, of course. But if we talk about well-being and health, I'm very sure that the healthcare system with the treatments, hospitals, general practitioners, doctors, etc., has not really much to do with health. Health is roots in our society, in our education system, in questions like equality, equity, in our living conditions, and of course also in our personal habits. I'm sorry, I'm very sure, but you need the conditions for living healthy. But it's not produced in treatment or in healthcare system, because you go to the doctor when you're ill, not when you're healthy normally. And we can change the system how doctors are paid. I would be open for that, but it's not my job within the health insurance.
Thank you. There was one question on this side, so please maybe a quick question and quick answers. Thank you.
Thank you. Make it quick. My name is Judith Schneider from Zeitposter. We are an organization in prevention and also neighborhood care. So people have others, usually elder people, and can save up their time for later when they need help. And we can see prevention on different levels. First of all, the person can stay at home for a longer time, need maybe professional care at a later moment, but also the helpers get active, get into a network, because they're usually also already retired, a lot of them, not everybody of course. But also the people who need help, maybe, so the people who have helped before, for them it's easier than to ask for help. So we have about 1,500 helpers active in Austria at the moment. My question for you, maybe Petra and Karin especially, how do you think, is this such a concept like a time bank concept? There is different ones as well as Zeitposter. How is that important, and what's the potential, what's the opportunities?
Thank you. Since you were directly addressed.
I could start. Yeah, I know the Zeitposter concept, but not so, I'm familiar with it, but not, I think in depth, so to really talk about Zeitposter here. What I would like to mention when it comes to healthy aging is really the caring communities approach, which I think you might be definitely familiar with. And I think this is, taking an approach also not only looking at healthcare institutions, but really looking at the potential of communities, mostly local communities, but also communities of interest, how people could, work together to identify care needs, and these needs could be very broad, like feeling responsible for caring for others, and then really supporting each other. This is a concept developed by John Tronto in care ethics, and I think this is an approach really addressing not only on a theoretical level, but also on a very practical level. We have projects on caring communities here in Austria. They are very popular in Switzerland. There have been a lot of projects also in Luxembourg, as far as I know, or in Belgium, sorry. So I think this is a really promising approach, because it really speaks to people in terms of their interest in volunteering, in supporting each other. And I think this is something we should definitely further develop. Still keeping in mind, and this is a criticism which comes from some researchers in Germany, still keeping in mind that we don't let social support functions step back, like social, what could it be? So we should really see that public attention for social support is still there, but we should also look at the local communities and how we could support them. So there's a little bit of attention in the concept, but I definitely agree that especially at the local level, I think these concepts work pretty well because people usually know each other, so they can connect very easily. So this would also extend to the question of how solidarity is lived in this local community, and if we could extend it, from the local communities onwards to regional communities. I think definitely that there's a lot of potential.
If you have...
No, I've nothing to add on.
All right, thank you so much. As we started the round with an initial statement, I'd like to close it with an ending statement, even though this is not the end, it's just the beginning. Maybe there is a word that you leave this room with, or a sentence or something like an aha moment, something new that you learned. Sandra, I'd like to start with you, and then you just pass on the mic.
Okay, so my statement is any sport is good, any health check is great. The Digital Health Club is just a new solution, a new offer that helps companies to reach their people, especially since we have home office, or also if you have a huge company with hundreds of sales guys who are never in the office, so you won't reach them anyway. And the Health Club is just seen as a extend the single measures companies have already, and it should be seen as a new digital tool. Thank you.
I'll just steal it from Petra, if I may. We need participatory policy development, and if there's one wish that I would like for the future is that, so that people from various communities are actively engaged in developing policies, and not only at the research level, but really at the implementation level.
Well, from my point of view, we can prevent up to 30% of chronic diseases by addressing the factors alcohol, smoking, physical inactivity, and poor nutrition and overweight. And what is urgently needed, in my view, is an integrated system approach in Austria, and an integrated strategy of all stakeholders, led probably by the Ministry of Health, but integrating the provinces, the communities, other ministries, all policy fields, in order to address these factors which cost us healthy life years and well-being of many individuals.
Well, since the participatory capacity building thanks for that, because it was hard to decide what to say at the end. Or then I would definitely lobby for another area which I think is pretty important, although it's not so prominent in many discussions. I would definitely lobby for capacity building in health promotion, to get young people like you involved in health promotion, hopefully as the health promotion experts in the future, but also to foster lifelong learning so that more people are working as experts in health promotion. Thanks.
Thank you so much. Before I ask you for a warm round of applause, also thank you from my side. I definitely leave with let's be more active, let's be the drivers of our health. And not just our own, but also for people within our communities, in our personal networks. And then, even though the term might not be too popular, but let's lobby for health in all policies.
Okay. Thank you.
Thank you so much.